Okay, yeah. Morning, Dr.
Pailin. Good morning.
Morning. How are you today?
You hear me?
Yeah. How are you today?
Oh, I'm fine. Thank you.
Okay, yeah. 5 more minutes. We will begin this seminar.
Yes.
Yes. Okay. You will be the first, Miss. Yeah, the first speaker.
I'm the first speaker.
Yeah. First presenter.
That's lucky, huh?
Okay. Yeah. Okay. Thank you, Bu.
Okay.
Morning,
Can we
Prof.
start now?
Yeah. Wait. 5 minutes more.
Oh, five
Yeah.
more minutes, huh?
Okay. Okay, let's begin now. Bismillahirrahmanirrahim. Well, ladies and gentlemen, may I have your attention, please? Our seminar will begin. Please have nice seat at your home, office, or wherever your location is right now. Thank you very much for preparing yourself to join our seminar today. Assalamualaikum warahmatullahi wabarakatuh. Good morning to you all. Honorable Director of Kadir University and the staff. Honorable the Dean of Health Science Faculty of Kadir University and the staff. Honorable the all speakers and participants of this seminar. My name is Pamadia Vitas Moron, the moderator of today's seminar. I'm very pleased to see you all here and welcome to all our this seminar today held by Health Science Faculty of Kadir University, Kediri, Indonesia. As we know that during the pandemic, the medical staff have the big role for caring the COVID patient. They devote their lifetime for the patient. During the new normal, they have their manner or their way for handling the patient. That is why this seminar today, we will discuss about handling the patient during the new normal era. Ladies and gentlemen, we have 3 honorable speakers for today. Let's greet them one by one. The first speaker is Dr. Pailin Nukulkij, Registered Nurse PhD, the Dean of Nursing Faculty, Pathum Thani University, Thailand. Good morning, Dr. Pailin.
Good morning.
Good morning. How are you doing?
Yeah, I'm ready.
Dr. Pailin is the assistant professor of this one. Sorry, yeah. Dr. Pailin, the assistant professor. The next Professor Pailin Nukulkij, Registered Nurse PhD. She got the education for PhD in the nursing science as perinatal, and then the University of Illinois of Chicago, United States of America, and then got the experience of working nursing faculty member, Barama Junani College of Nursing Bangkok, Ministry of Public Health, Thailand, and then also the director of Barama Junani College of Nursing Bangkok, Ministry of Public Health, Thailand. The current work is the Dean Faculty of Nursing, Pathum Thani University, Pathum Thani, Thailand, and then also the Vice President, Pathum Thani University, Thailand. That's about Dr. Pailin. Now the time for Dr. Pailin to present the material. Dr. Pailin, the time is yours.
Yes, thank you everybody.
You're welcome.
Could you hear me?
Yes, we can hear you. Yeah.
Oh, can you hear me? Okay. I think the new normal, the situation of new normal all over the world is very similar. But I'm talking about the handling patients during new normal in Thailand, that we can share our experience among us. Okay. As everybody understand, it's new normal is changing lifestyle after COVID-19. People are more awareness in health than the day before. Then we focus on how to handle patients during new normal. Let's start first. First, the nurses and other health personnel have to be awareness of self-protection by we strictly put on mask on the time, washing hand before and after providing care, take a bath and change uniform before going back home. If the provider is a nurse, they cannot wear a nurse cap during this time. They have to wear the disposable cap that they can throw it away after they finish work. Taking a bath, change uniform before going back home, carry alcohol gel for washing hands on the time. Do not wear uniform to public area. This cannot do that. Cannot wear uniform to the public area. And everybody have to take vaccination, especially influenza, pneumococcal vaccine, and maybe anything else like a chicken pox or measles, something like that. Then the second, this is a big job that the hospital service system has been changed to fit new normal. Let's begin with the first thing that we have changed a lot during new normals is we use touchless medical services like a telehealth, telemedicine. A telehealth and telemedicine, especially the patient with the chronic illness like hypertension, diabetes, heart disease, that sort of thing. And then they use telehealth, telemedicine, online consulting. And when the people have a problem, they can consult the doctor online. The doctor then provide online prescription. Then they can go to online payment. And medication will go by EMS, by post, and maybe a drive-through service. The consulting about a health problem, we can use SMS, right? Then we provide health education on COVID-19 prevention to people, especially through health volunteers. We use a lot of health volunteers in the community. Okay, number two, the physical distancing at the hospital. It is very strict at the hospital, especially at the waiting area. The people have to sit 1.5 to 2 meters distancing. Also at the hospital canteen, also keep physical distancing at the same 1.5 to 2 meters distancing. Use chill such as counter chill, cashier chill, face chill, especially when at the counter between when the health personnel have to communicate with the patient or the people who come to the hospital. They have to talk and use chill at the counter. Limit only one accompany for one patient. Before new normal, there are a lot of relatives accompany the patient, maybe 2 or 3, sometimes 4. But during this time, the new normal, they limit only one accompany for one patient only. Abstain from visiting patient. Instead of visiting patient, they use telephone. They can visit by phone. They can look at the video call instead. We can use extra screening. We use thermal scan. When the people go to the hospital, at the entrance, they use thermal scan. If you have fever, you cannot enter the hospital. You have to go to the the clinic that to investigate for the COVID-19 instead. And the people need to take the history checking about what they have been somewhere, especially the high risk area. Skin COVID-19 infection of high risk group. Everybody put on mask on the time while staying inside the building. Everybody have to care for personal hygiene. Everyone provide alcohol gel for hand washing for everyone. In the hospital, at the outpatient department, or even inpatient department, they will put alcohol gel or alcohol spray at the convenient area that the people can get easily. And put on this possible cap instead of nurse cap. The physician and nurse have to wear hospital gown. They cannot wear like a suit or necktie, and there's no need for that during this time. They have to use hospital gown only. All medical staff have to strictly follow the rule of the hospital for COVID-19 prevention. And safe and clean. We are very strict on the safe and clean. Clean on contact areas such as table, chair, ladders, lifts, escalators, that sort of thing. With disinfectant every hour. Clean and spray inside room, building with disinfectant twice a day. Clean medical equipment after using. When we use any kind of equipment for one patient, and after that we have to clean it, and then use the new one for the new patient. Clean wheelchairs, stretchers, ambulance, and car after using. And we have to separate used mask from general garbage, because the mask we use maybe we can carry the virus to spread to other. So we separate used mask from general garbage. This the COVID-19 situation in Thailand. This is yesterday. The data is from yesterday. Now we have 3,376. Yesterday we have 17 new cases. All of the new cases yesterday come from outside the country. They are on staying at the state quarantine. Everyone who come from outside the country have to stay at state quarantine for 14 days. And during these 14 days, we can find somebody that get infection from COVID-19. Like yesterday, we have 17 cases. At the moment, we have recovered patients who can return home, 40,173. Yesterday we have 3 more that they can they're better, they're getting better and can return home. Now so far we have 145 cases that's staying in the hospital under the treatment now. The number of deaths is still 58 for maybe more than 6 months. We have 48. They're not increased. This is there is not new case found in our country for more than 2 months now. It is we are lucky, but we are not we are still aware of the phase 2 of the infection. So if they don't have the new case in the country for more than 2 months, but we still restrict all of the personal hygiene or the step of the COVID-19 protection. However, the new cases found nowadays were from outside the country. All of them were at state quarantines. We come to this successful situation because the cooperation of all Thai people. Everyone follow Ministry of Public Health instruction. Everyone put mask. Everyone put alcohol gel for hand washing, like this. Everyone have to social distancing. If you will stick like this, I think the second phase will not come, but we are still aware of it.
Next question for Dr. Pailin. Hello,
Yes,
doctor.
yes.
Yeah, can you hear my voice?
Yes.
Yeah, the question from Natsir from University of Bukit Tinggi. He asked about what is the role of student to apply the handling patient to society.
The student.
The student role as the student role to apply this material for society. What is the student role to apply this
The student
material
role?
to society? Yeah.
Oh, you mean the student go to school?
Yeah, no, I mean the student, health student perhaps. The health student. The
Children?
university student for nursing, the university student nursing.
Oh,
Yeah, the role of
I
them.
see, I see. You mean the nursing student, right?
Yeah.
Okay. For the nursing student, we have to study online for a while during the infection, like maybe 3 months or 4 months.
Yeah.
They study online. They study from home and submit the homework online also, and they take exam from home also. But we have some problem with the practicing in the laboratory.
Yeah.
That when we teach them online, maybe I think they have only one. It's two-way communication, but they still don't understand very much like they study in the nursing lab. So we have to wait until the infection is slowed down, and the government allow us to start school about half of July, at the middle of July. Then the students come to the university, but they cannot go to practice in the hospital until I think now they still at the laboratory nursing lab. I think at the end of the month, so they can go to practice in the hospital. But before they go to the hospital, they have to like a 14-day quarantine, vaccination, have to follow the instruction like get mask, alcohol gel, that sort of thing. And I think every university in Thailand have to start at the same time, that at the end of the month that they can go to practice in the hospital.
Okay.
But at the hospital, at the university, they have to like put mask, thermal scan, put mask, alcohol gel, hand washing, and social distancing, that sort of thing that presented before.
Okay. Thank you, Dr. Pailin, for the nice answer. One more question for Dr. Pailin from Mr. Jatmiko from Kadin University. He asked about during the COVID-19 pandemic, are there a consideration for surgical or another procedural care setting?
Only please, again, please.
Yeah, during this COVID-19 pandemic, are there consideration for surgical or other procedural care setting?
Surgical?
Surgical,
You mean surgical treatment?
and other procedural of care setting. Is there any procedural or surgical care setting during this pandemic?
Oh, you mean if they have to they need the surgical treatment, right?
Yeah, surgical treatment during this pandemic. What's
Or the surgical treatment like emergency treatment like appendicitis, right?
yeah.
Okay. Okay. If that happens, so they have to complete physical exam of the patient that they have COVID-19 or not. If they don't have any, but we cannot wait for the surgery for a long time because maybe the appendix will be ruptured, so they can do the emergency treatment.
I see. Okay. Yeah. Thank you. Next question for the all speakers. It is from Astrid. He asked to Dr. Pailin, Professor Sasli, and also Miss Yeni, how is the Thailand and then Indonesia and Malaysian effort to keep the COVID number low? How to decrease? Maybe from Dr. Pailin first. How is the effort of Thailand to make the number of COVID-19 become decrease?
Become decreased?
Yeah.
Oh, for
From
me, I think the cooperation of the people in the country is very important. If all of the people follow the direction or follow the guideline that the Ministry of Public Health or the government provide to all of us. If they follow that, they will be safe. But anyway, maybe we cannot control everybody, but most of them is follow the rule.
Okay, thank you. Next, about from Malaysia, how is the Malaysian effort to keep the COVID number is low? Yeah, Professor Sasli, the time is yours to answer. The next question from Budita, Universitas Kadiri. She asked to Dr. Pailin and then Professor Sasli and also Bu Yeni how to manage the overprotective attitude during the COVID-19. Can you hear Dr. Pailin? How to manage the overprotective attitude during the COVID-19?
Oh.
Yeah.
How to manage, right?
Yeah. How to manage. Sometimes we feel afraid, and then it will become us as the parent feel overprotective attitude for the kid especially. So how to manage this attitude to make it not get serious?
Oh, in Thailand we use a lot of health volunteer that they can work in the community, and then they work very close with the families in the community, and we have to work closely with the school also, the teacher at school, so that we have to tell our children about the COVID-19 is not only involved that the respiratory system, but they involve blood system also, even the other system of the body, and we have to like a really close relationship, like let them afraid of the disease, understand what's going on about the disease, and then have to cooperate with the healthcare provider about how to stop the disease. It was very difficult, but most of the time people is cooperate. It's very good.
Okay, thank you, Dr. Pailin, for your answer. Finish? Thank you. I and all our team for the international seminar today apologize for the shortcoming and mistake of today's seminar. Thank you very much for the honorable speaker. You are very amazing today. Your material is very nice and very benefit for all of us. Hopefully, this seminar will be give much benefit for everybody in the world. Amin. Ya Rabbal Alamin. Hope to see you again in another seminar held by Kadin University. Thank you for your coming today. Have a nice day. Assalamualaikum warahmatullahi wabarakatuh. Bye bye.
Bye bye สวัสดีค่ะอาจารย์ สวัสดีค่ะพูดภาษาไทยได้